This recording will go over gastroenteritis. Gastroenteritis is a very common health problem worldwide that causes diarrhea and/or vomiting as a result of inflammation of the mucous membranes of the stomach and intestinal tract. It affects mainly the small bowel and can be caused by either viral, which is more common, or bacterial infections. Norovirus is the leading foodborne disease that causes gastroenteritis. So it's the leading cause of gastroenteritis. And interesting enough, norovirus is actually named after Norwalk, Ohio, because in Norwalk in the 1960s, there was an outbreak among school-aged children. Ended up getting the virus identified not too long after that, and it got the name norovirus. It occurs most often between November and April because it's resistant to low temperatures and has a long viral shedding before and after illness. Noroviral is transmitted through fecal-oral route from person to person and from contaminated food and water. Infected individuals can also contaminate surfaces and objects in the environment. Vomiting may cause the virus to become airborne. The incubation time is 1 to 2 days. In most cases of gastroenteritis, the illness is self-limiting and lasts about 3 days. However, in those who are immunocompromised or in older adults, dehydration and hypovolemia can occur as complications requiring medical attention and possible hospitalization. Outbreaks of norovirus have occurred in prisons, on cruise ships, and in nursing homes, college dormitories, and other places where large groups of people are in close proximity. Hand washing and sanitizing surfaces and other environmental items help prevent the spread of the illness. Proper food and beverage preparation is also important to prevent contamination. The patient history can provide information related to the potential cause of the illness. Ask about recent travel. Inquire if the patient has eaten at a restaurant in the past 24 to 36 hours. Some have acquired gastroenteritis from eating in fast food restaurants or from food items purchased at a farmer's market or at a grocery store. Bacterial infections have caused large outbreaks that resulted from contaminated spinach and lettuce in the U.S. The patient who has gastroenteritis usually looks ill. Nausea and vomiting typically occur first, followed by abdominal cramping and diarrhea. For patients who are older or for those who have inadequate immune systems, weakness and cardiac dysrhythmias may occur from loss of potassium from diarrhea. Monitor for and document manifestations of hypokalemia and hypovolemia. For patients with gastroenteritis, note any abdominal distension and listen for hyperactive bowel sounds. Depending on the amount of fluids and electrolytes lost through diarrhea and vomiting, patients may have varying degrees of dehydration manifested by poor skin turgor, fever, but this is not common in older adults, dry mucous membranes, orthostatic blood pressure changes, which could cause a fall, especially in older adults, hypotension, oliguria, which is decreased or absent urinary output. In some cases, dehydration may be severe. It occurs rapidly in older adults. Monitor mental status changes, such as acute confusion, that result from hypoxia in older adults. These changes may be the only signs and symptoms of dehydration in older adults. For any type of gastroenteritis, encourage fluid replacement. The amount and route of fluid administration are determined by the patient's hydration status and overall health condition. Teach the patient to drink extra fluids and to replace fluid lost through vomiting and diarrhea. Oral rehydration therapy may be needed for some patients to replace fluid and electrolytes. Examples of oral rehydration therapy include Gatorade, Pedialyte, and Powerade. Depending on the patient's age and severity of dehydration, he or she may be treated in the hospital with IV fluids to restore hydration. Drugs that suppress intestinal motility may not be given for bacterial or viral gastroenteritis. Use of these drugs can prevent the infecting organism from being eliminated from the body. If the healthcare provider determines that antiperistaltic agents are necessary, loperamide, brand name Imodium, may be recommended. Diphenoxylate hydrochloride with atropine, brand name Lomotil, reduces GI motility but is used sparingly because of its habit-forming ability. The drug should not be used for older adults because it also causes drowsiness and can contribute to falls. Treatment with antibiotics may be needed if the gastroenteritis is caused by bacterial infection with fever or severe diarrhea. Depending on the type and severity of illness, example of drugs that may be prescribed include ciprofloxacin or azithromycin. Frequent stools that are rich in electrolytes and enzymes and frequent wiping and washing of the anal region can irritate the skin. Teach the patient to avoid toilet paper and harsh soaps. Ideally, he or she can gently clean the area with warm water or an absorbent material, followed by thorough but gentle drying. Cream, oil, or gel can be applied to a damp, warm washcloth to remove stool that sticks to the open skin. Special prepared skin wipes can also be used. Protective barrier cream can be applied to the skin between stools. Sitz baths for 10 minutes 2 or 3 times daily can also relieve discomfort. In regards to preventing transmission of gastroenteritis, advise the patient to wash hands well for at least 30 seconds with an antibacterial soap, especially after a bowel movement, and maintain good personal hygiene. The patient should also restrict the use of glasses, dishes, eating utensils, and tubes of toothpaste for his or her own use. In severe cases, disposable utensils may be wise. The patient should maintain clean bathroom facilities to avoid exposure to stool. Inform the healthcare provider if symptoms persist beyond 3 days. They should also not prepare or handle food that will be consumed by others. If the patient is employed as a food handler, the public health department should be consulted for recommendations about returning to work.